started. Ready?
These are late,
Oh, late.
late public comments for item 6.
Okay, 6. Okay. Good morning, welcome everybody. I'd like to go ahead and call the Health and Hospital Committee meeting to order this time. I am Supervisor Otterly, the chair of the committee, along with Vice Chair Supervisor Margaret Abikoga. With both supervisors present, we have a quorum. So moving to public comments, this is item reserved for members of the public to address the committee on items not on this agenda. And any public would like to speak on items on the agenda should request to speak at this time.
I currently have one request on Zoom.
Okay, let's do 3 minutes.
Our speaker is Ken Horowitz. You'll have 3 minutes. We'll open your microphone. And the timer will start when you begin speaking.
Good morning, Supervisor Lee and Obakakoga.
Oh, the sound cut out.
You cut out? Oh.
We heard the beginning of your comments, but we're not hearing you now.
Can you hear me?
Yes,
There
we
we
can.
go.
Now we can.
Can you hear me now?
Yes.
Yes, this is Supervisor Lee and Supervisor Abakoka. Dr. Ken Horowitz from the Health Advisory Commission. And first of all, I want to thank you both for supporting our Health Advisory Commission's pilot program on integrative medicine. And we look forward to Santa Clara Valley Healthcare coming back to the Health and Hospital in March on an implementation and a long-term strategy, as well as Supervisor Ellenberg requested information about food services from the Public Health Department, and also Supervisor Young requested information about integrative medicine services from Valley Health Plan as well as from the Family Health Plan. So again, we want to thank you for the support, and we hopefully someday we won't be talking about integrative medicine, services like acupuncture and Chinese medicine as integrative medicine, but just as good medicine. And then finally, I tried to get through on Tuesday to the Board of Supervisors. I wanted to bring attention to a Senate Bill 707, which Governor Newsom signed back in October regarding teleconferencing for advisory boards. As you probably know, it's been very difficult to fill vacancies on a number of our advisory boards. And one of the problems is that members can't make it in person. So it's hopeful that your council will look at Senate Bill 707 and consider teleconferencing for advisory boards as an effort to fill some of these vacancies. Again, I wish you all happy holidays, happy Hanukkah, and the best of the new year 2026.
Thank you, Dr. Horowitz. And I think that's the last comment, correct? Yes.
Correct.
So moving to item number 3, which is the approval of the consent calendar. I actually would like to add item 11 regarding the report from the SCVH on the disposal of medical waste to consent. Do you have anything else? You second that as a motion? And I do want to have one comment on consent calendar regarding item 16, regarding the VSO report on the Staff Sergeant Barker Gordon Fox Suicide Prevention Grant Program. So I want to thank our Darlene and the VSO for providing monthly reports on this suicide prevention programs. I see that we've had some turnover at the social worker position, and we are currently trying to fill that position. And I'm pleased that
Apologies.
the overall
Chairperson.
progress to refer veterans at risk for suicide. And I would like to request that this item be turned into semi-annual reports on the consent calendar, the April and October HXC meetings in 2026, since the program will now provide services until September 2026. That being said, I've got a motion, I've got a second. Let's see, anybody would like to speak on the consent calendar? Oh,
Double checking. I have no request to
I
speak
got
at this.
somebody raise their hands on the consent calendar.
Oh, sorry.
Just right by the podium, please, Darcy. Yeah. Good morning.
Good morning. Darcy Green. I'm a member of the Race and Health Disparities Community Board. Just wanted to, in advance, thank you so much for your support of our work. I know our work plan is, I believe, on the consent calendar today. And just, again, thank you for the support of our work. Looking forward to continuing to inform you all about the work that we're doing around not only uplifting race-based health disparities in the community, but working in collaboration with county staff in order to make sure that we are doing our part to help reduce and eliminate race-based health disparities in our county. So thank you all so much for all of the work you all do all of the time on behalf of patients everywhere across the county. Thank you.
Thank you, Darcy. Okay, oh, one more card. Those are not for consent, are they? They're for
I don't believe so. I believe these are all for item 6.
6. Okay, yeah, I believe so.
Yes.
One more?
Okay. Still nothing for this item.
Sure, okay, so if that's the case, we have a motion second, no public comments. One more on the consent, let's take a vote.
Vice Chairperson Abekoga?
Aye.
Chairperson Lee?
Aye as well.
Thank you.
Okay, moving to item number 4, to consider recommendations relating to medical staff and allied professionals at SCVMC, O'Connor, St. Louis, and Regional Medical Center. I believe we have Dr. Salmon from the Enterprise Medical Staff present to present.
Thank you, Chair Lee.
Oh, yes.
Supervisor Salmon is,
Oh, hello, I'm on
oh, there
Zoom.
she is.
Oh, hi, Dr. Salmon, good morning.
Hi, good morning. My apologies, I got stuck in on 880 in an accident.
No worries, but we hear you loud and clear. That's good, Dr. Salmon. Welcome. I think we have the report. Do you have nothing to add? Then I'll just go ahead and open up the public to see if anybody would like to speak. Nope, no public to want to speak on this item, correct? Okay, should I have a motion to approve?
Yes, just want to say I'm glad to see that we're hiring new physicians across all our hospitals in different specialties. And with that, I'll make a motion to approve the item.
All right, I go ahead and second that. Let's go take a vote.
Vice Chairperson Abekoga?
Aye.
Chairperson Lee?
Aye as well. Okay, that passes. Going to move item number 5, considering recommendations relating to federal, state health policy and budget landscape. And I believe we have, let's see, is Mr. Margolin here today?
Mr. Margolin is available by Zoom.
By Zoom. Okay, very good. Thank you, Amy. Amy Carter from Director of Government PR and Special Projects, who is here. Good
I'm
morning.
sorry. I'm having trouble hearing both the chairperson
Oh,
and the
you
vice
do?
chairperson. If you could move closer to your microphones.
Okay, I'll
Thank
try
you.
to do better there.
Thank you, thank you.
Okay. All right. Mr. Margolin, do you have a presentation today?
Mr. Margolin, we see you're online. It looks like there's your microphone.
We are. Now the mic's on. Yes, can you hear me?
Yes.
Okay, yes, good morning. I do have a presentation. Federal healthcare landscape. Let me start by stating that the top federal healthcare issue remains the effort to extend the Affordable Care Act subsidies. That was the issue at the center of the government shutdown, and we're all very familiar with the general outline of the issue. Open enrollment is coming to an end soon, and failure to extend the subsidies is producing on average a doubling of the premiums for the 22 million people in the Affordable Care Act exchange system, which in California is known as Covered California. Covered California did an estimate at the end of last month on what not extending the subsidies would mean here in California, and they said that it would produce an average premium increase of 97% in California, and as many as 400,000 people could lose coverage. The Senate voted last week on 2 proposals to extend the subsidies, and both efforts failed. Democrats had their proposal, Republicans had their proposal. The only silver lining here is that 4 Republican senators did break ranks, and they voted for the Democratic subsidy extension bill. So there was some movement towards bipartisanship. The Republican proposal, which failed on a party line vote, basically took, and this is sort of key to the whole debate in Washington right now, it took the subsidy dollars and rather than applying them to making these incredibly sharp premium increases go away, it said we're going to apply them to health savings accounts. That's where the money should be spent, according to Senator Cassidy, who sponsored the measure. And health savings accounts have a value in the system. They help individuals pay for out-of-pocket expenses like deductibles and co-insurance, co-payments, but they can't be used for the cost of premiums. So it doesn't help people maintain their policies in the face of this incredibly sharp premium increase, and that's why, again, Democrats as a bloc voted against it. The short way of describing health savings accounts is that they're actually helpful for healthy people who have these out-of-pocket expenses, but they're not effective in sustaining health insurance coverage for people with medical conditions who need more comprehensive coverage. This week, the action is occurring primarily in the House of Representatives. The House is planning as early as tomorrow to vote on an alternative which will not, at least as of this moment, include an extension of the enhanced subsidies. We'll know the details of what the House is going to vote on probably in the next hour or two. We're reasonably certain that they're going to make a variety of changes to incrementally affect how health insurance is provided, some of which may be marginally helpful, and some of which may actually weaken the Affordable Care Act. Let me just tick through really quickly, because these are terms you're going to be hearing about in the next day or so, the kinds of things that will be in the House Republican package. They're going to create something called, try to create something called choice accounts. These are accounts that will allow employers who don't want to continue to have a group insurance plan to offer their employees money that will help them buy individual policies that will not be taxed. So it's a strategy to, in a certain set of cases for small employers, help them move their employees into insurance outside of their group coverage. Then there's something called cost-sharing reductions. This was part of the original Affordable Care Act, and what this was a payment stream that was designed to reduce the amount of deductible individuals would have to pay. They're essentially get rid of and or reduce out-of-pocket costs. It was challenged in court for somewhat technical reasons that we don't need to get into. And President Trump in 2017 actually got rid of the cost-sharing reductions. The Republicans now talking about restoring them, and this would be helpful. It might decrease premiums by as much as 10%. So there actually is a value to doing this, but when you're dealing with 100% increases, a measure that might increase some premiums by 10% is far away from being really helpful. They also want to encourage more association plans. These are plans that people in the same industry or community can enroll in. They're historically plans that healthier people like to enroll in because the costs are lower. And these are harmful to the exchange system because they attract healthy people who might otherwise be in Covered California to leave Covered California, leaving sicker people in the pool, and it puts pressure on premiums to actually increase. There are a few other provisions. The last one I'll mention is pharmacy benefit manager, PBM reform. This is a battle that Democrats and Republicans are concerned about because pharmacy benefit managers are correctly accused of having kept pharmaceutical prices higher than they should be. But the House bill, we'll see more detail later today, may include a provision on PBMs that's largely cosmetic and weak, involving transparency. The harder line reforms, we're told, are not going to be in this House package. So to summarize, the House will vote tomorrow on a package that will have no provision to address the doubling of premiums, which is the main reason Democrats are going to oppose it. It appears to be an effort, and I'm sure it's going to be fairly criticized as an effort to address the issue in quotation marks, but actually miss the mark. It's primarily cosmetic, and the most important other point I would make is it has zero chance, even if it passes, of getting 60 votes in the Senate. Now, there are bipartisan efforts still being worked on in the House, and this effort at optics or politics to sort of suggest they're addressing the problem is really not working with a fairly critical group of House and Senate Republicans who understand this is a real-world issue, the doubling of premiums. You can't ignore it. It affects 20 million Americans, and they don't want to simply engage in cosmetics. So there are Republicans working with Democrats in both the House and Senate on this issue. In the House, it's taking the form of discharge petitions. There are 12 House Republicans who signed one or another of the discharge petitions. There's no consensus yet on whether to move on discharge. Democrats have their own discharge petition. There's no bipartisan agreement, but there are a number of Republican House members who don't want to simply let this continue to move forward without some action. There was a push last night, actually, by these House Republicans to get agreement in the Rules Committee today to allow for an amendment on the floor when the bill is taken up tomorrow to extend the enhanced subsidies. As of last night, it appeared as if the House Rules Committee was not going to grant that amendment. And House Republicans who are pushing for action appeared last night to be deferring and not challenging the leadership. Again, this is all happening right now as we speak, so that this may change, but right now it looks as if there won't be an amendment on the floor. The discharge petition route is still available, but that takes time. It's not going to happen in December. That's more of a January dynamic. So while the House is sort of moving on this cosmetic effort to show interest in healthcare without really solving the problem, the Senate hasn't given up yet, even though both Senate bills failed last week. There was a meeting last night of 20 senators, a bipartisan collection put together by Susan Collins of Maine, including Dick Durbin of Illinois, Senator Shaheen of New Hampshire, and others, a bipartisan group. And they are working on a proposal that they may unveil publicly later this week to extend the subsidies. It can't be acted on in the month of December, so if they unveil a proposal, which may or may not happen this week, that would once again be a January agenda item. But the elements of their plan appear to be a 2-year extension of the subsidies with a cap on income eligibility, which some Democrats are willing to accept, providing it's a reasonable cap. And there's also fraud protection language in there. And there's actually, even though Democrats and Republicans appear to be bitterly divided, there actually is a fraud issue that needs to be addressed that the General Accounting Office did a report on that came out recently. And it takes the form of insurance brokers who are enrolling people with false income information. So they're getting the subsidies, getting enrolled, and the income information is not appropriately validated. So there's a bipartisan agreement that this fraud, which is a small part of the system, and like any large government program over many years, you have to watch out for fraud and abuse and take steps to address it, that this broker abuse needs to be addressed, and that could be in the package as well. So the enhanced subsidy debate's not going away. It's going to dominate this week. It'll dominate much of January. Meanwhile, there's an appropriations process. 3 appropriation bills have been passed already and signed into law. 5 more bills the Senate is attempting to package them together. The current, and that includes labor, Health and Human Services, The current continuing resolution expires January 30th, so there'll be an intense effort in January to get this appropriation process online. There seems to be some cautious optimism that rather than having, once again, a full year continuing resolution with status quo funding, that these appropriation bills might actually get over the finish line. And if you are interested in why that's likely to happen or possibly going to happen this year, no guarantee, one of the key factors is really the return of community projects, otherwise known as earmarks. There are a lot of senators and House members who are adamantly against federal expenditures in the operation of lots of federal programs, except when it comes to projects in their district. And that dynamic, which was helpful in past years in getting appropriations agreements, seems to be operating again this year. Lots of House Republicans and Senate Republicans want these district projects funded. So no guarantee of whether this will happen and whether we might have another short-term CR, we might have government shutdown, that's possible in January, but there is a lot of work going on in the appropriations process. So that completes my report. I'm happy to respond to any questions or comments you might have.
Thank you. Let's see if any public would like to speak on this item.
For all of item 5, I have no requests to speak, and chambers are on Zoom.
Okay. Vice Chair? Okay, yeah, thank you so much, Mr. Goland. Things are changing very quickly in the federal landscape, and I'm not going to the very much details onto every deal that comes through and falls apart, and so I don't think I'm going to that. But one thing for sure, though, is the continuing resolution deadline. This time around, it's going to be end of January, right?
Yes, January 30th.
Right, so that will be the next potential fight that we might be seeing. That might be another shutdown up to
Yes.
the 30th. Yeah. Okay, so that's something we need to be aware of. But at least past this end of this year, we shouldn't have to worry about it for now. Okay, all right, and that's all I have. So, oh yes, go ahead, James.
I just wanted to add a couple additional updates, just for the committee's awareness. One is we're obviously looking ahead also to the governor's budget January 10th. Word on the street is that we're expecting pretty significant Medi-Cal-related cuts layered on top of federal cuts in the governor's budget proposal. So we will, of course, see what happens when we see what's published. But that would, of course, be very bad news for us and would exacerbate the cuts that we're forecasting based on the federal picture and outlook. So we'll keep the committee and the board appraised of that, as we launch our state advocacy push, which might be a real uphill one in the event that there's additional state cuts layered on top of those federal ones. But we are seeking state support to try to help mitigate what's happening federally. The other thing I just wanted to share with the committee is apparently in Los Angeles County, an effort has been launched for a local sales tax related to HR 1 cuts and hospital and healthcare funding in Los Angeles. So it looks like some of the leadership that we have shown is already spreading to other parts of the state. So I wanted to share those two pieces of news with the committee, and we'll know a lot more. The governor's budget's released January 10th, and we will of course look at that very carefully as soon as it comes out. But we're quite concerned based on what we're hearing in terms of rumors.
Thank you, James. Yes, Margaret.
A question on that. So we were hoping that we would get state assistance to help us with the projected $1 billion deficit hole. So is this on, are you saying that that the third that we are hoping the state would help us with is in jeopardy, or even more than that?
I mean, we don't know until we see what we see, but it seems like our advocacy efforts are going to be uphill in the sense that we may have a governor's budget proposal that actually puts us in even a bigger hole. So, I don't think we expected the governor's budget to propose any augmentation, and so we knew that would be our big advocacy push between January and the budget adoption in June. But we may be pushing uphill in the sense that we may also be advocating that the legislature reject additional state cuts, in addition to asking the legislature to help support relief for public hospital systems. So I think it just highlights a couple things. One is that, we of course can't necessarily count on state support. We have not assumed any state augmentation in our budget forecast. That would be pretty imprudent. But we will face very devastating level of cuts without it. And second, it, I think, just really puts a finer point on how vigorously we're going to need to advocate and push to get the state to really do the right thing. And I just share that because one of my concerns is that the state is maybe approaching some of these conversations from a really short-term, myopic standpoint, where, for instance, putting some investment up front in helping keep people on Medi-Cal enrollment actually will help the state budget as well as the budget of healthcare delivery systems across California by being able to draw in federal funding through retention of people on Medi-Cal and insurance. But if the state is going to be penny wise and pound foolish and not put a little investment up front in those data systems and processes and support for county social services agencies, et cetera, we could really face billions further in cuts in the subsequent year. So I think part of what we have to do is really engage in those conversations, not just with our delegation, but across California, that it will pay billions of dollars in dividends to put some tens of millions, hundreds of millions in investment up front to try to keep people on enrollment. So we're working on all of our advocacy-related materials. We're going to be putting a lot of energy into this beginning in the new year, but I think it's going to be an area of tremendous importance and focus because the consequences otherwise are just devastating. And as a reminder, even though we're right now most immediately focused on the $470 million in cuts that we're facing in the upcoming fiscal year, we have another $500 million in impact the year after that. And what that looks like will heavily turn on state-related strategies, particularly related to enrollment. So more to come, but we're keeping our eye on the ball, and we are going to put as much energy as we can in those efforts so that we can try to mitigate what's happening here locally.
Thank you.
Okay, thank you. Okay, so I have a motion to receive report,
Yes, I make a motion to receive the report.
and I'll go and second that.
Vice Chairperson Abekoga?
Aye.
And Chairperson Lee?
Aye as well.
Thank you.
Moving to item number 6, which is relating to the ALCOVE program from the Behavioral Health Service Department report. And I believe Dr. Terrell, you will be presenting this, correct?
Yes.
Morning.
Good morning, Chair Lee and Supervisor Abekoga, Sherry Terrell, Director with our Behavioral Health Services Department. We also have some of our Behavioral Health Services team joining us on this item. Before we move into the discussion, we don't have a formal presentation today, but are available to answer questions. We did just want to start off by indicating that we are working on alternatives to maintain services in North County at a reduced cost, and appreciate very much the community's support for coming up with ways to do so. So just wanted to set that tone
Great,
for our
yeah.
conversation today. I have our team here, Megan Wheelahan, our Deputy Director, Zelia Free Acosta, our Children's Executive, Jennifer Pham, our Division Director, and Stephanie McWhorter, our Executive over our SET services.
Great, thank you very much. Welcome. Okay, I believe we have a lot of cards on this one, right? How many do we have?
I have 11 cards and hands going up on Zoom. Again, if you intend to speak on item 6 relating to ALCOVE Palo Alto, now's the time to raise your virtual hand. We appear to be holding at 10 on Zoom, so for a total of 21.
Oh, wow, okay. Okay, so 1 minute each.
Okay, would you like to close the queue at 21?
Yes, please, let's do it.
Okay, 1 minute each. We'll begin with the speakers in chambers. I'll call a few names if you could form a line behind the podium. Pat Burt, Greg Young, Sally Bemis, Olga Lizama. Go ahead and begin your comments into the podium.
Pat, just go by the podium. There's a mic built in, yes. Go ahead. Good morning.
Good morning, and thank you very much for consideration of this item. Thank you to the supervisors and to county staff who met with our mayor and myself. We're very interested in the commitment from the county to form a new baseline from which we can build this program and enhance its utilization. We, as you probably know, are in Palo Alto in the midst of our third youth suicide cluster. It's traumatic to our youth in our community, and this function provides a really important drop-in service level of at one location. We are committed going forward to supporting this through financially and in-kind services from both public agencies, the school system, hospitals, philanthropies, and other partners. Thank you.
Thank you, Pat.
Good morning, Greg Young. Thank you for the opportunity to speak today. I work as the Central Alcove Team Network Director, and I just want to touch a little bit about the importance of Alcove. So as we know, Alcove is about young people for young people, and is built upon the foundation that young people's voice is the most important voice in building this service. I come from Australia, where we have 186 centres across Australia. When I first started with what was called the Headspace Centre, there was 13, now 186. The Alcove model is based upon that evidence-based practice. Also across Canada, Ireland, Netherlands, South Korea, Japan, all in the process of implementing them. I also just want to flag quickly that there's been a lot of discussion around fidelity to the Alcove model. Just want to make sure that people realise that fidelity doesn't happen today, it happens over time. And many of the other centres that we're working with, it's taken them 2 years to reach fidelity. San Mateo, San Juan Capistrano, Beach Cities all have taken that time. Thank you.
Thank you.
And I'm sorry, you were Greg? Thank you.
Hi, my name is Sally Bemis. I'm on the Youth Community Service Board, and we've recently signed an MOU with Alcove, and thank you for this opportunity. And I'm going to play 12-year-old Nathan's statement about what Alcove means to him. And it's not playing. I'm sorry. He spoke at the public town hall meeting that Margaret had for us and talked about his anxiety and how Alcove has been very important to him. Mm-hmm. He's a regular participant. He loves going there, and he volunteers there as well. Mm-hmm. So thank you very much.
Thank you very much.
And after Olga, can we hear from Selena, Genevieve, thank you for the phonetic spelling, Stephen, David, and Tess.
Yes, good, start.
Good morning, I have a video. This is the first part.
There's this barrier between other resources offered at school, other resources that don't feel as accessible as Alcove does. And those things that Alcove offer, the peer support, the therapy, the psychiatry, the physical support, are resources that many youth cannot get anywhere else. And so I remember when I went for my first time, I went through the full sessions with therapy. It was incredibly helpful, and I got connected to resources afterwards. And I don't know what I would have done had I not done that. And to speak more recently, one of my best friends just a couple weeks ago went to Access Resources. And I'm so grateful that she reached out to me, and I'm even more grateful that the first thing I thought of was Alcove. Let's go to Alcove, let's get you signed up, this is going to be great, there are youth there, this is going to be so much fun. And we went, and I talked to her literally this morning.
Thank you.
Thank you.
Hello, We're finishing the youth speech.
Yeah, I went and I really, really enjoyed it. And I don't know where else I would have gone. Thank you so much. And so it really, really worries me to see cuts like this done to our critical mental health resources. Because yes, there are psychologists, yes, there are therapists, but those are hard to find and even harder to access without parent permission. And the amazing thing about youth, the amazing thing about ALCO, is that it supports youth by youth for youth. So I really, really hope that we can all look at these budget cuts and see that it is such an issue, especially regarding critical youth mental health support like ALCO. Because ALCO is one of a kind, and I know there are hundreds, if not thousands of youth who, maybe they haven't accessed it yet, but even the idea that it exists in their community is supporting itself.
I'm sorry, you were Selena? Yes. Thank you.
Hi, I'm Genevieve Pierre-Dixon, and I'm the Mental Health and Wellness Supervisor at Palo Alto Unified School District. I've been in the district since 2017 and had the opportunity to help build and create our in-house mental health program, where we support students with therapists on all of our school sites from TK all the way through 12th grade. We have an opportunity to work really closely with ALCO for all of our secondary students. And as we all know, and one is coming up right now, that we have large breaks in school with winter, summer, spring break, right? And so we are not available to our students at that time. And it means a lot to us as a therapeutic team and as a clinical team to have somewhere to send our students who need that support, who may not be able to access that for a wide variety of reasons, especially around parental consent. And not only that, just having a safe space for students to engage with one another, to have fun, to engage in activities, to see mental health and wellness in a fully encompassed way, and not just therapeutic direct support, but also physical support as well.
Good morning, I'm Stephen Lee from Project Safety Net. Just wanted to let you know we have over 300 members of our community who have signed a petition urging the county to save ALCO and reform it in some way, and that includes nearly 200 of our youth, and that continues to grow. Right now, our youth are in final season, so they're obviously busy, but we expect that number to grow. Wanted to read a couple testimonials. The first is from a 7th grader at one of our middle schools. I walked into ALCO on a day when I honestly wasn't sure I wanted to keep going. Everything in my life felt too heavy, and I got good at pretending I was fine, even when I wasn't. Someone listened to me, really listened, and I guess in a way helped me find words for things I've been carrying alone. I kept going back. Little by little, my panic became less, and the darkness surrounding me felt less suffocating. They reminded me that I wasn't alone and that my life still had room for hope. ALCO didn't fix everything overnight, but it gave me a lifeline when I needed one most. In a very rare way, it saved my life. Thank you.
Good morning, Supervisors Lee, Abe Koga, County Administration. I want to thank you all very much for your leadership on the Alcove Center and services, balancing fiscal needs, community behavioral health needs, and community input. Since 2009, there's been only one area of the county that actually has endured 3 suicide clusters. And from my experience, there's a reason why every 7+ years, there's a whole new cohort of kids. They don't remember what happened in the previous, what happened before. So Alcove is that longitudinal effort to bend that trajectory. Alum Rock commits to doing everything we can to support the community effort in North County and the North County redo on Alcove. Thank you all very much.
Yes, go ahead and speak to the podium.
Hi. Hi. Oh, okay. Hi. Sorry. My name is Tess, and I wouldn't be here without Alcove. Alcove saved my life by nature of offering mental health and career support during a tumultuous period. I am now applying to law school, also with Alcove's help. Its position as a youth community center that also offers critical physical and mental health services is so important, particularly in Palo Alto, where children have turned to drastic measures due to a lack of support and community. Everyone knows someone or knows someone who has killed themselves. When pressure is being felt both at school and at home, it's absolutely crucial that young people are offered a third space as an option to reaffirm their importance as a community member and feel wanted. Removing, restricting, or weakening the presence of Alcove in Palo Alto will exacerbate the growing culture of isolation and individualism in Palo Alto. That it offers these services at low or no costs means that cutting Alcove's budget will disproportionately affect youth who have no other options for mental health care, reproductive education, or career advice. Thank you.
Thank you.
And finally, we'll have Pei-Ying Lee and Ana Lilia Soto.
Hi. Hi, everyone. I'm Pei-Ying, Director of Community Partnerships at Project Safety Net. We're a community organization based in Palo Alto to promote youth suicide prevention and mental wellness. Alcove Palo Alto has been such an integral partner for the ecosystem that supports youth well-being, resiliency, and suicide prevention. In the past years, we've worked very closely on team programs, community engagement, and education outreach so that folks can know that Alcove Palo Alto is a one-stop hub for mental health, behavioral health services for youth 12 to 25. More recently, we've also worked very closely on trying to promote healing, grief support, and Alcove is a place where young people can make appointments but also really walk in to get access to a variety of services, community support, peer support, whatever they need. So we look forward to working with our partners to really support Alcove Palo Alto's future. Thank you.
Hello. I'm just going to be sharing some words from one of my young persons, Chloe. Oh no.
Graduated from Gunn High School in 2017, and I was a youth advocate who worked on the development of Alcove throughout my time at Gunn and while I was an undergrad at Stanford. During the suicide cluster that began in 2014, I lost multiple friends and classmates. It was painfully clear to me that Palo Alto's youth desperately needed better mental health care, a program that was accessible, stigma-free, and truly shaped by young people's experiences. Before Alcove, these supports simply did not exist. We fought for this program to be built because the lives of our peers depended on it. Alcove is also much more than clinical care. It's youth-driven.
Whoa. Technical difficulties.
Let's pause it for a second.
Thank you.
Gunn High School in 2017, and I was a youth advocate who worked on the development.
Oh, speed it up.
Community. My time with Alcove inspired me to study psychology at Stanford, pursue research in suicide prevention, and eventually become the manager of a behavioral health research program. Today, I'm also earning my master's in social work, all thanks to the opportunities and support provided to me by the team at Alcove. To close, I also wanted to share that since leaving Palo Alto, I've been contacted by multiple students from Gunn who have told me that the services at Alcove has saved their lives. Preventative youth mental health care is a necessity, not a luxury, and our community should know that better than anyone. With adolescent mental health challenges on the rise, preserving Alcove services is essential. Please continue to stand with our youth. Thank you.
Then we'll move to online speakers. The queue was closed earlier, so I'll be going off that list. Our first speaker is Sitare. You'll have 1 minute. The timer will start when you begin speaking.
Hi, my name is Sitare. I'm speaking today as a youth advisor with Alcove and the Stanford Center for Youth Mental Health and Wellbeing. I'm here to ask you to reconsider the closure or relocation of Alcove Palo Alto due to budget cuts. Palo Alto has experienced suicide clusters that deeply impact young people, families, the schools, and providers. And at Alcove, youth advisors like me aren't just there for show. We actively help shape services, outreach, and engagement so that the youth feel like they're able to access something that's non-judgmental and accessible. And when youth lose trusted, welcoming spaces like Alcove, they don't easily just move to other systems. Many fall through the cracks, especially those who are already marginalized and unsure about how to seek help. And closing Alcove sends a message to young people that their well-being becomes optional when their budget cuts are happening. And thank you so much for listening to Youth Voice.
Our next speaker is Shashank. Please go ahead. The timer will start when you begin speaking. Shashank, I see your microphone's on. Try one more time. Your microphone's open, but we are not getting any audio. Last call.
Hello?
There
Good
we go.
morning.
Yes, we can hear you now.
Can you hear me okay?
Yes.
Thank you. Good morning. Shashank Joshi, professor of psychiatry at Stanford. Alcove is not just a mental health clinic, it's youth-led, designed with youth, for youth, as you've heard from our youth. It not only reaches youth early, often before they've told anyone else they're struggling. You've heard from students who said it saved their life. This is a flagship of a nationally recognized model. More than a third of our young people say they would not have sought help anywhere else. I think it's worth highlighting that a high number of youth have moderate to severe mental health issues on screening. Over 10% screen positive for possible psychotic illness. To cut Alcove now would silence a proven model of prevention, intervention, and life-saving hope. Our young people have told us what they need. Now is the time, especially in financial crisis. We must stand by them.
Our next speaker is Rob George. Please go ahead. You'll have 1 minute.
Good morning, everyone. Can you hear me?
Yes.
My name is Rob George. I'm Project Safety Net board member, treasurer, and more importantly, father of 4. I encourage you all to support a critical member of our collective, Alcove. The cluster is a tragedy. Please do not create a funding tragedy for this organization. And more importantly, please do not further silence the youth of our community. Thank you very much.
Our next speaker is Allison Rosen. Please go ahead.
Can you hear me?
Yes.
Okay, so I'm a clinical professor at Stanford, licensed clinical psychologist, and a parent of a child who went through the system. I sent you an explanation of why Alcove matters to our community, but one story still haunts me. A parent reached out to me about her son's friend, a previously happy child who'd fallen into severe depression. The family didn't speak English and lacked insurance, and we couldn't find a pediatric psychiatrist who spoke their language and who had an open
Allison, we lost you. Can we pause the time and... Allison, try one more time to finish that comment.
The family didn't speak English, lacked insurance, and we couldn't find a pediatric psychiatrist who spoke their language and had an opening. His condition worsened, and ultimately we had to persuade the boy to be hospitalized. After discharge, they struggled to navigate follow-up care. I believe Alcove could have connected this family to timely services and likely prevented his hospitalization. Thank you.
Our next speaker is Nayeli Gomez. Please go ahead.
Buenos dias. I'm the mom of Nathan, a 12-year-old that has general anxiety disorder and is just like a very advocate for alcohol. I'm gonna play like his video when Supervisor Margaret was here. And by the way, something that he said was like, authorities don't hear boys, so they only listen to adults. And he said that like to Supervisor Margaret at the time. So, and here is my kid.
Therapy, there's also other things that can help you, like information that you never knew about. And like, I think it's really helpful because you can also be with your parents at times. You can enjoy many fun activities. Talk about like what's been on your mind or anxiousness or something like that. Because it can be like kind of tough.
Our next speaker is Becky Beacom. Please go ahead.
Yes, good morning. Thank you. I'm Becky Beacom with the Herd Alliance and longtime community member, also in support of ALCO. I'll be reading today for a high school student who's asked to remain anonymous. We need to show the county how it's so hard to find easy access mental health support, how the Alcove staff community vibe is extremely valuable, how Alcove is something unique about Palo Alto, and how mental health conditions are at an all-time low for teens nowadays in Palo Alto and everywhere. And the big problem nowadays is that nobody talks about their mental health since they think it alienates them, and no one else talks about it. If Alcove is abolished, that's just going to make this problem worse. Not to mention this problem could be solved with therapy, and the only free place right now is Alcove. Thank you.
Our next speaker is Julie Lithcott-Hames. Thank you.
Okay.
We'll close the microphone for Julie online. She's going to speak in the room. And whenever you're ready.
Hello, Supervisors. I'm Julie Lithcott-Hames. I'm a member of the Palo Alto City Council. First, I want to express my gratitude for your tremendous work in county health and for being the provider that got this alcove off the ground in furtherance of supporting and saving young people like Tess and the other youth you've heard from this morning. With the budget cuts you're facing and the related burden on county staff, and with the dire youth mental health crisis our city continues to face, we hope we can segue responsibility for operations to a community provider while continuing to receive financial support from the county in the years as we transition. That transition time will allow us to build additional community partnerships to support Alcove, both operationally and financially. Thank you again for your service and for your consideration.
Thank you, Julie. Who else do we have?
We have two more on Zoom. I have Mayor. We'll open the microphone. You'll have 1 minute.
Hello, my name is Mary Lucas, and I'm the mother of a student from the second cluster who died by suicide named Zane. I have started an action group in Palo Alto, a community group, just trying to get together, trying to do something, because I just can't take another student dying. It's very hard to hear of anybody considering cutting or changing anything when we need to quadruple down on everything we're doing, because I just can't think of anything more important than the lives of our children. And we have to think about everybody's child is our child. They are our children to protect. The stats are that 1 in 5 students consider suicide, 16% make plan, and 9% attempt. If I fill that in with cancer, everybody would have a very different reaction. And I implore you to not only save it, but to give more money to save our youth.
And our final speaker is Shravanti. Please go ahead.
Hello. So can you hear me? Sorry.
Yes.
Okay. So I grew up in the Santa Clara County in the wake of the first suicide cluster. I had my own experiences with mental health, and I found my voice through Alcove and advocacy. I was involved. I was a youth advisor in the development of the first Alcove Center in Palo Alto. I went on to study psychology at Columbia. I wrote my senior thesis on Alcove. I know that the model is evidence-based. I know that it saves lives and that it's necessary. And I know that if a concern right now is service utilization, that there are a lot of real outreach efforts going on. I myself was involved in a research project with Alcove to push for anti-racist care and basically address the fact that people of color are using services less. And I think that this model will just take a little bit more time and funding to get to the place that it needs, and I hope that that can be maintained.
Thank you. That concludes public comment. And just a quick note from the clerk that there were some late public comments emailed this morning, and those were printed and distributed to the members on the dais. And that concludes public comment.
Okay, great. Thank you so much. I'll go and close the public queue in terms of the speakers. I'll ask the vice chair, you have any questions for staff on this report? Go ahead.
I don't actually have questions. I do have some comments.
Okay, go ahead,
Is that
please.
right?
Yeah,
All
sure.
right, thank you. First of all, I just want to thank staff for bringing this forward, and also thank the community for coming out today and sharing your testimonial. It's always really helpful to hear, and it means a lot. So thank you for that. As I've shared in the past, I'm a committed advocate for mental and behavioral health care and services, especially for youth. That stems from my own lived experience with my older daughter. So I really appreciate the thought and care that's gone into this report and this whole process. It's evident that to me and many others that Alcove is a major asset to the community. And to better understand the benefit that Alcove provides to our young people, as mentioned, my office organized a community meeting and a listening session with Alcove users and stakeholders. Nearly 150 people attended this meeting, with about 100 in person and 50 on Zoom. And I want to thank Sherry and the BHSD staff for being there and participating in the meeting, along with with experts from Stanford. Many students, and we heard some more today, shared the way that Alcove has positively impacted their lives during this listening session we had. And some of the highlights that we heard from the young people were about how Alcove is so valuable, and that included Alcove being free and having a low barrier to entry, Alcove not requiring parental permission, the trust in Alcove that cannot be easily replicated, as the space was, as mentioned earlier, built by youth, with youth, and for youth. As has been mentioned, suicide has impacted numerous students in our community, unfortunately, and most students who spoke mentioned that they knew someone who had been impacted by suicide. We heard that again this morning. And finally, the students shared they would not have gone anywhere else, as there are no other places in the area that can provide similar services. After hearing from the perspectives of our young people in this session, my office and I met numerous times with Alcove stakeholders. Throughout this outreach, it became evident that no matter how we proceed, we have an obligation to ensure Alcove continues to help young people thrive. The trust that young people in North County and throughout the county have in Alcove is immense, as they were involved in every step of creating the space, and it would be nearly impossible to start from scratch. Especially given the recent suicide clusters in Palo Alto, I cannot support any proposal that eliminates mental health services and funding for Palo Alto or North County. I obviously understand the financial crisis. I think I've shared that many times. I take the budget very seriously, but I believe our community is trying to step up to take more financial responsibility, and they just need more time and a bridge to make this happen. Accordingly, I'd like to get to a solution that provides adequate funding for these critical behavioral health services while reducing the county's cost burden. The City of Palo Alto and Project Safety Net have outlined thoughtful proposals that they've shared with us, and I believe there is consensus around how to preserve these important, often life-saving services for our youth. So if I may, I'd like to make a motion that to direct staff to create a proposal of $1.75 million for 3 years with CPI increases built in for years 2 and 3 to be provided to a community-based service organization to deliver behavioral health services to youth in North County. Further, BHSD will engage with Alcove and youth mental health stakeholders to ensure this proposal provides a seamless transition for administering North County mental health services. Finally, BHSD will return to HHC in February with a final proposal to gain input from the committee before bringing the proposal to the Board of Supervisors. And I just want to say that, yes, so the goal here is to continue to maintain mental health services in North County, and, to frankly, be able to expand utilization of those services. And, again, I look at this and I really appreciate the community coming forward. It really, to me, is a community effort. And I've said this, I look at this as a point in time at the county where we are facing huge financial crises, but, the times will change again. And this is a time when the county, frankly, needs to lean on the community a little bit more. But again, it's a relationship, it's a partnership, and things will fluctuate. And I hope that in time, when things get better, we'll be able to actually expand our services. Thank you.
Yes, and I'll definitely second that. First of all, I just want to thank all the speakers that came in today in person and also on Zoom to talk about the work of Alcove. Going back a little bit, when this first got started, I believe this was, I would call the baby of our former supervisor, Joseph Midian, that came up with this idea. It was started as an idea, and it finally came to fruition, and it's been one of those programs that I would have to say is so gratifying to see that the community truly appreciates the work that Alcove has been providing. And very few times, we do difficult work in our county all the time, but truly life and death situations, this is one of those situations where it actually saves lives. And that's been proven. And so for that reason, I certainly do strongly support that the Alcove program needs to continue. The current funding structure probably was not sustainable in the long run, given all the challenges we have financially, but I do think that if we could come up with another way to run this program, to keep it going, I think it's really something that we need to move forward on. Actually, I see a light on. Go ahead.
Yes, sorry, I just wanted to make a parliamentarian
Sure,
point.
please.
I certainly appreciate this really important discussion, but the agenda is noticed only to receive report as opposed to making motions and maybe getting into things that are probably better reserved for a budget discussion.
Sure. James, go ahead.
Yeah, what I would share is, as I think Sherry shared at the outset, we're committed to working with the relevant stakeholders on putting together an appropriate proposal. The appropriate time, I think, to bring that forward and discuss that is as part of the budget process. I think we hear loud and clear the strong support for Alcove, also the real willingness and engagement to look at an alternative model that's more fiscally sustainable given what's happening, and we're committed to working on such a proposal as part of the overall county budget process in the coming months.
Yes, go ahead, Chair. Vice
Thank
Chair,
you.
go ahead.
As a committee, my hope was that we could make that recommendation to the board. So I understand today might not be that time, but at our next meeting, perhaps. And I did include that I would like to ask staff to bring back a final recommendation for us to move forward to the board. Can we do that?
Well, the real timeline for that would be as part of the budget process. So we don't usually piecemeal individual programs as part of kind of budget proposals, except through that timeline and process. So, the department's budget proposals will be in front of the committee in April. The recommended budget will come out in May, but that would be the kind of appropriate timeline and process.
So in April, in this committee, will we hear?
In April, this committee will receive all of the departmental recommendations from both behavioral health and all the other healthcare-related departments. Will all be on the agenda for the committee in April.
Right. So we can expect then what we've discussed here today to be fleshed out a little more, perhaps. But,
yes,
come
you
back
can expect any proposal related to Alcove will be part of that.
So just to clarify, James, based on our budget starting July to June, the current Alcove program is scheduled or has been budgeted to at least June 30th, 2026. Am I correct?
Yes.
Yes. So that would not
Yeah,
change.
no one has
Always, right?
proposed any
Nothing will
changes
change
within this
until
fiscal
June
year at
30th,
all.
Right, exactly. So whether or not how this program will continue after July 1st is what we'll be discussing during the budget program. But in the meantime, doesn't mean our advocates and folks should not be working together to find solutions to propose. So by the time April comes, hopefully by then we'll have a better solution to propose. Does that make
Absolutely, and the
sense? Yeah.
department will need to be working on the alternative models. I know there've been a few different things that have been discussed, and be able to flesh that out and put that together as part of its proposal. And of course, there'll be many, many other behavioral health-related proposals included in that budget conversation, of which Alcove is certainly one important piece, but the entirety of all of the behavioral health proposed changes.
James, would it be appropriate for us to hear this again in February on our meeting, just to get an update on this alternative method discussion, just to see if things are moving? I just want to. Well,
Certainly, we can certainly return with a report in February.
Great. Yeah, that would be very helpful. Yeah, thank you.
Great. Thank you. And I withdraw my motion.
Okay, all right. But well, you have a motion to receive the report. though, right?
Yes, I guess I'll change my motion to receive the report.
Okay, the receive report, and also to have for the report coming back in February, HXC for an interim update on any alternative model, working with stakeholders. That's fair? Okay, that's the motion. I'll second that. All right, good. All right, about further comments? Let's take a vote.
Just so that I made sure. So the motion is to receive the report and the request from Abe Koga to receive an interim update in February.
February.
Correct.
Yes.
Thank you.
Thank you.
Vice Chairperson Abe Koga?
Aye.
Chairperson Lee?
Aye as well.
Thank you.
Great, thank you very much. All right, moving to item number 7, which is receiving report from Custody Health on behavioral health relating to substance use treatment services. And we have our CHS Director, Dr. Rochelle Luna, and I believe also Dr. Trow as well from Big Trustee. Good morning.
Good morning, Chair Lee and Vice Chair Abakoga, Rosiolina, Director of Custody Health Services. I'm going to have our team in Custody Health just introduce themselves so that you know who's here, and then I'll turn it over to my colleagues behind me for behavioral health.
Hi, I'm Alex Chorney, Medical Director for Adult Custody Health Services.
Good morning, Dr. Cole, Nurse Executive, Custody Health Services.
Good morning. I'm Dr. Tiffany Tejada. I'm one of the physicians with Custody Health Services.
Good morning. Michelle Delacaille, oversee the CalAIM Justice Involved Initiative.
Thank you.
So we don't have a formal presentation with UNENO behind me or our behavioral health department colleagues also that co-wrote this legislative file and report. So we're open to any questions that you may have. But again, we do not have a formal presentation.
That's fine. I'll see, any in the public like to speak on this item?
Last call for item 7. I see no request to speak.
Okay, good. Let me go ahead and close the public queue in terms of speaking. Check it with my vice chair. You have any comments and questions on this?
Yes, thank you,
Please.
Chair. Thank you so much. I appreciate the work that's being done and as a component of our health equity and justice reform work. I had a few questions. What is the projected need for the SUTS, S-U-T-S, across the system over the next 3 to 5 years? And does current expansion meet that need?
May I ask you to clarify when you mean SUTS, do you mean Substance Use Treatment Services by Behavioral Health Department or Adult Custody Health Services specifically?
Through Adult Custody Health Services.
So we are projecting that the need will only increase. I'm not sure that we can give you exact numbers, but the fentanyl epidemic continues. While we have seen a little bit of a leveling of deaths from overdose, the number of positive tox screens that we see in our patients, the number of patients that we are serving is only increasing, and we are currently limited by our resources and staffing limitations. So if we had more to offer, we would offer more.
Are there any facility constraints?
There definitely are facility constraints on provision of these services because, as you know, jail is quite a old institution. Building's been, some of them date from the 50s and 60s, some from the 80s, and there's very limited space for private interviews, very limited space for groups to take place. So while we are able to see patients in the clinics, the treatment for substance problems include counseling, include behavioral health treatment, and all of these need space, which we sorely lacking.
I guess I could. I'm not on public safety committee, but just curious as to where we are on the planning of the new jail facility. If you can give a brief summary here, that's great. Or
sure. I know there've been some more updates at the Public Safety Justice Committee, but we retained a consultant to do a full facility needs assessment for all of the custodial facilities. I believe that has been completed, and the draft is under review by county staff at this point. Once that's completed, that'll form the basis along with the already completed population-related projections for putting together then a facilities plan. That'll then come back to the board, and then we'll have to begin that process of things. So, it is undoubtedly clear that we need a very significant overhaul of facilities. One of the questions that needs to be looked at more is what are some of the interim measures, including facilities that might need to be taken offline because they're in such poor condition in the interim. But it's going to be a multi-year endeavor and undoubtedly also a very costly one. There's major issues both at Main Jail and at the Elmwood campus. Right. And space for programming and healthcare delivery is one major issue. The staffing required to safely move and monitor inmates is a major issue that is inextricably intertwined with the actual layout of the facility and the fact that the facility layout, especially at Elmwood, requires lots and lots of movement of individuals across a very large campus in order to take them to spaces for that healthcare delivery. So there's a bunch of facility-related issues. We also have major issues at Elmwood with the classification of the nature of the inmates that we have in custody not aligning with the original design of the facilities. So the assessments are underway. I don't know off the top of my head exactly what month that's scheduled to come back to the committee. I think to Public Safety Justice. I don't know if
It's January, actually.
yeah, so soon.
Okay.
Report back January.
But it is the subject of regular updates at PSJC.
Right. Thank you. I appreciate that. One other question. I was actually asked by somebody, what our harm reduction program entails, and specifically when it comes to safer consumption of supplies, including needles, pipes, and foil.
Sure. Supervisor, I'm happy to answer that question. Dr. Sarah Redman, Health Officer. We have operated one of the state's longest running harm reduction programs that stays at the forefront of everything that science shows us helps people stay alive while they're struggling through addiction and drug use in order to get to recovery and a safer life. That began with access to syringes at a time when HIV through the rest of the country was still being widely spread through injection drug use. And that's part of why here in Santa Clara County, we actually see very little HIV spread through injection drug use. Several years ago now, I think starting in San Francisco, some robust studies showed that not only are people less likely to contract life-threatening infections from injecting drugs, but they're much more likely to die of overdose when injecting compared to using drugs via any other mechanism. So we began, as well as harm reduction throughout the country and throughout the world, offering alternatives to injection. So for anyone who was not ready to quit use completely, while we continued to offer and facilitate that service for those willing to accept it, we did offer alternative mechanisms such as pipes that allow people to switch away from injecting drugs, knowing that that makes them much less likely to experience a deadly overdose, as well as less likely to experience things like a bloodstream infection that may land them in the hospital or cause significant disability.
Great. Thank you. Appreciate that information. Thank you.
Thank you very much. Yeah, so when I read the report, I would say the most eye-opening thing is that the number of people that are under monitoring for alcohol and opioid abuse relative to our jail population is so high, and really highlights the actual need for us to treat folks when they are in our care. So this conversation certainly have came up at the PSJC meeting, and I understand, as we said, we are doing a report back in January to explore more options for more inpatient care that we could provide to our residents who is in our care. So I look forward to that coming back to us, certainly. In the meantime, I would say thank you, staff, for presenting a report. It's very sobering and clearly something that is something we need to focus more on in terms of making sure that folks in our care should be able to get any detox type system if they are being offered as widely as possible. So Supervisor Avakova, may I have a motion to receive the report?
Thank you. I will happily make a motion to receive the report.
Okay, I'll go ahead and second that. Thank you. And let's go take a vote.
Vice Chairperson Abe-Koga?
Aye.
Chairperson Lee?
Aye as well.
Thank you.
Okay, thank you. Moving to item number 8, which is the received report from the Public Health Department expanding the Black Infant Health Program.
Well, thank you, Mr. Chair. Madam Vice Chair, I'll get started as my team heads over to the staff table. But today I'm very pleased to introduce 3 leaders from our Black Infant Health and Perinatal Equity Program. Let's see which order they're going to sit down for you. So many of you recognize in the red jacket Dr. Beverly White Macklin, our Program Manager 3, who oversees both these programs and has been with our department for, she is approaching her 25-year anniversary imminently. So she has been, in many ways, the heart and soul of what you're reading about today, part of its implementation from the very beginning, and part of the reason that we have this powerful suite of programs to address one of the most striking disparities in our county, in which we continue to find today that the Black infants born in our county are still twice as likely to die in infancy as infants of other races. And so this team has dedicated its service to both direct services to families, folks who are pregnant, postpartum, expanded into a program called The Role of Men that supports fathers and fathers-to-be, and several years ago expanded into the Perinatal Equity Initiative, which uses state and local resources to augment the federal Black Infant Health Program to offer services such as doulas and mental health supports that we know were called for by the community and were incredibly necessary for the safety safety of our Black parents and families. And so to represent these two components of the programs, Tanya Robinson is Program Manager 2 with day-to-day oversight of our Black Infant Health Program, and Shilpa Joshi, Program Manager 2, overseeing the Perinatal Equity Initiative and the Role of Men program. We have no formal presentation for you today, but the Ledge file itself walks through the various types of work we do in this area, the incredible achievements of the team, and we're here to answer your questions.
Thank you, Dr. Redmond. Yes, let's see, any in the public like to speak on this item today?
Yes, for item 8, I do have 1 card in chambers
2 minutes.
and 1 hand in Zoom.
Yes.
We'll
Please
give
come on up,
2
right by the podium,
minutes.
please. Yes.
We'll change the timer to 2
Morning.
minutes. Damali Tillman, go ahead.
Yes, hello, hi, thank you so much for having me. I just want to say that I just really appreciate being a part of Black Infant Health. I am one of the staff, I'm the social worker.
You state your name? Yeah.
Oh, sorry, Damali Tillman, thank you. I think the biggest thing for me is I just really wanted to be here to support my management team. Dr. Beverly White Macklin has been a pivotal part of our organization. She is Black Infant Health. You can't say Black Infant Health without saying Dr. Beverly White Macklin. So I'm just here as a support. And one of the things that I think is so important is that I know that we have the budget cuts. I know that this has been a very hard, challenging time for our county, but our county continues to step up where we really need the assistance. And right now, one of the things that I see happening is I know we have to do reconstruction and change like departments of where the director has to be. And for me, I think that would be a disadvantage and a disservice to Dr. White Macklin due to the fact that she's 25 years in, and also the fact that we want her to be able to retire on her own terms. And that looks like being able to retire in December 2026 with dignity and pride. We need to make sure that that happens, that our team is able to transition to that. Also that our moms and our, just the people that are part of our community, they're also able to transition. We definitely are open to working with the county to make sure that the efforts to find the cuts where we need to and being very creative on how we do that so that the service and continuum care continues to happen for our moms. We have a lot of community partners that support that, and I'm here just to support that as well. Thank you so much for this time today, and please consider just leaving her where she's at until December 2026.
You will. Thank you.
And we'll move to our Zoom speaker, Walter Wilson. You'll have 2 minutes. We'll open your microphone. And go ahead.
Yes, good morning, Chair, Committee. My name is Walter Wilson, and I'm one of the authors of the African American Health Study, of which Dr. Macklin was so important to help do and create, and which also about the Roots Clinic here in Santa Clara County, as many of you know. But more recently, Dr. Macklin has been very, very involved with the Role of Men program. It's never happened before in this county, which many of you don't know is the person who's running that program under Dr. Macklin, my son, Robert Wilson. But the key is this: her leadership has been crucial to helping the Black community with doulas and so on, so forth, help create a situation where the Roots Clinic just recently had 100 births of African American kids without any problems whatsoever, and with the support of Black Infant Health Care and Dr. Macklin's leadership in supporting Roots Clinic. I'm saying to you here today that she needs to remain in that position until her retirement, and that her leadership and continued leadership is very important to having programs like this for African American people in this county. And I feel confident that I'm speaking on behalf of the African American population in Santa Clara County. Thank you so much, and I appreciate your time.
Thank you, Mr. Wilson.
And that concludes public comment.
All right, thank you. Yes, Vice Chair, do you have any questions, comments?
Yes, thank you,
Yeah, please.
Chair. And I just wanted to, first of all, just thank staff for bringing this forward and for the incredible work that's being done to lessen the really the greatest disparity that we're seeing in the healthcare here in our county. I obviously believe in equity, and this is really great work to get us to a more equitable community. I just had one question. I was wondering how you measure the success of the programs such as the doula care or the group classes.
Can you hear me?
Yes.
Okay, great. What we're doing is working really closely with our science branch at Public Health, and they're taking our data and really teasing out and fishing out anything that they see that is abnormal or patterns within these women. So what we want to do is to keep pulling this data so that we can see and measure any changes that we might have because of the program. And the state also has us taking data every day on each client. They're assigned a number, and they take extensive data on these women. So what they're looking for is the same we are locally in our county, is similarities. What are we seeing? What are the causes? And so far, those have been, over the years, the problems that we're seeing are all over the board. So there's not just one particular thing that these women experience where they have an infant death. Some of them are low birth weight, premature. There's congenital abnormalities, stillbirths, preeclampsia. We were seeing this when we did chart reviews when we first started the PEI program. So we were able to go in the Valley Hospital and get a sample of 15 births. And we went through the chart to see if we could see anything that was abnormal. And what we found was it was all over the board. So that's what we're trying to do now, is to really look deeper and find what the system changes and structural changes that we need to make that will keep providers in the loop with us so that these moms can have quality care.
Great. Well, thank you. Thank you so much.
Thank you so much. And do you have a motion to receive report?
Yes, I'm happy to make a motion to receive the report.
And I will
Thank
go ahead
you.
and second that. So first of all, thank you so much for this report. And want to, of course, thank Dr. Beverly White-Macklin for all her service and her years or decades of dedication to this program in our community.
Thank you,
Thank you.
Supervisor Lee.
And then the other thing is, I don't necessarily have any specific questions, but really I'm thankful that you are looking at this issue with a much closer look of the data and identifying any patterns, right, of abnormalities where we could try to identify what's truly happening that is causing these problems in our community still. What is something that's unaware by a lot of folks is people thought that black infant health death has more to do with economic factors. It turns out it's not.
No.
It's not at all. So if that's the case, it's not a matter of economic issues. It really is affecting every black mother and black infants. This is something that is very peculiar to this population. I think we really need to work on fixing this. And our county certainly is truly committed to fixing that. So I just want to say thank you so much for your important work and keep up the good work.
Thank you very much.
All right. And without any further ado, let's go take the vote.
Vice Chairperson Abekoga?
Aye.
Chairperson Lee?
I as well.
Thank you.
Thank you so much.
Thank you. And Merry Christmas.
Merry Christmas.
Happy Hanukkah and all that.
And happy Hanukkah and happy holidays. Yes. All right. Moving to item number 9, receiving report from the Santa Clara Valley Healthcare Facilities and Fleet regarding the Enza West Valley Clinic. I believe we have Jeff Draper, our facilities director. Of course, we also have our SCVH CEO, Paul Renz.
Thank you, Chair Lee. We have Celine Ho, our primary
Oh,
care
yes.
director, to report out on our progress with Deanza.
Good morning.
Good morning.
Chair Lee. For this report, over the past several months, we have engaged Deanza administration to find some temporary solutions to provide a temporary clinic on the Deanza campus. Two of the options that were presented to the Deanza administration was around creating a satellite clinic on campus as well, or provide a medical mobile unit on the Deanza campus to provide some of the medical services there. After we spoke with Deanza administration, they fully endorsed having a medical mobile unit on site. The satellite clinic was problematic in terms of licensing and space constraints there. And so we have engaged, they reached out to us and provided a temporary facility license for which County Council is currently reviewing. And once that gets implemented, we'll have a planning session in terms of the dates and schedule to provide the services on site.
Okay, thank you so much. Jeff, anything to add?
No, sir. Thank you.
Okay, good. Any public would like to speak on this item?
I have no request to speak on item 9.
All right, I'll go ahead and close the queue. Do I have a motion?
Yes. Well, I just want to say thank you. Thank you to staff. Thank you so much, Paul. I as you know, I've been asking about this and advocating for it since I joined the board a year ago. And I know the West Valley region has long anticipated this facility, and I think this will be is a great first step. I know, I'm sure the community will be very excited, and thank you again for working so closely with Deanza College on making something happen. I'm so excited for the mobile medical unit. I think it'll be well utilized by the students and the community, and my hope is that it'll actually help with maybe expanding our patient mix and be a positive an attribute to addition to our healthcare system. So again, just want to say thank you, and with that, I'm happy to make a motion to receive the report.
Just going to second that. So certainly very glad to see that we are having a backup options on this, and with the mobile medical unit for 1 year, certainly it would be established even quicker, right? So I think it's good to have it started, all right, given the services established, and evaluate the actual numbers and needs of the Deanza community. So I think that's a great way to get started. Given the fact that we have, lots of budget impacts from McCharles 1 and all that coming up, we are literally staring at a $500 million a year deficit. So we need to make sure that we are fiscally responsible in moving forward. And since it's somewhat challenging, to say the least, to establish this clinic given these type of budget environment, I certainly do hope that that the service is being provided, at least in the short term, but in the long term, if we can potentially build this full-fledged clinic, is absolutely the goal, as suggested by my former colleague, Supervisor Joseph Minion, and our community has imagined way back in October 2021. So let's hope that could be possible. But in the meantime, I think mobile clinic is really the way to go. All right, I have a motion, I have a second, let's take a vote.
Vice Chairperson Abekoga?
Aye.
Chairperson Lee?
Aye as well. Thank you. Moving to item 10, consider recommendations relating to the Child Adolescent Behavioral Health Services Center.
Supervisor Jeff
Yes,
Draper
Jeff.
from the Facilities and Fleet
Yes.
Department. You have our report. It looks like we're having a few difficulties with the fire life safety system in terms of making sure we get it over the finish line with HCI. This is the time of the project. It's always the most challenging, the last 5% of the project. So there's still some work to be done on the outside of the facility as well. It looks like we'll be finishing up somewhere around the middle of February, and with a hopeful opening date, first patient day of 1 April. That's the current report.
1 April.
Yep.
Okay. So it's not April Fool's Day, it's real, right?
It'll be the opening day.
All right, Paul, you have something to add?
No, I just want to reiterate that we are still targeting April 1st, and we will advise if we have any other challenges relative to licensing And we'll work with your office in terms of planning for that event.
Okay, thank you. As we know, Regional Medical Center was also opened on April 1st last year, so that's becoming the date that lots of exciting things happening in our system, apparently. So let's shoot for that date, if not earlier. We can do that, that'd be great. All right, any public like to speak on this item?
Confirming no speakers on item 10.
Okay, do I have a motion to receive the report?
Yes, I'll make a motion to receive
Okay,
the report.
and I'm not going to second that. I just say, I mean, certainly there's been some delay, but these delay has not been as significant as it used to be that we've been seeing a couple of years ago when we have a supervisors committee, and those becomes relatively contentious a meeting that we had when these days keep slipping. From Joe does not take those lightly, and you know, and certainly that's how we need to do the oversight to make sure the project keeps going. We have the biggest one was having to change a contractor. That was difficult, but we got that happen. So glad to see where we're moving forward. So let's move this forward. Thank you so much. Appreciate it. And on that, let's go take the vote. We got a motion and a second.
Can I confirm the motions for 10A and B?
Yes, that's right. For both 10A and B.
Thank you. Vice Chairperson Abe-Koga?
Aye.
Chairperson Lee?
I as well.
Thank you. That carries.
Thank you. Moving to item 11, which is the, 11, we removed from consent. So last item today is 12, regarding the emerging healthcare issues. Coming ahead. Yes, I believe, Paul? You have this one, yes?
Thank you, Chair Lee and Supervisor Abakoge. Just a few updates. One, as James Williams had mentioned at the full board, Valley Medical Center has been named a 2026 high-performing hospital for maternity care by the U.S. World News and Report. It's obviously the highest distinction available. It is the 5th consecutive year for Valley Medical Center, obviously reflecting the consistent excellence in maternal care and neonatal care by our staff and our healthcare system. I also wanted to share with this committee that beginning in January, Santa Clara Valley Healthcare will launch a coordinated cardiac service line for our enterprise. This is an example of one of our budget initiatives to actually improve our efficiency, but also address and further improve our patient outcomes. The approach will actually consolidate complex cardiothoracic and structural heart procedures at Valley Medical Center, and of course, allow us to build our capacity to serve more patients going forward as a healthcare system. The other item I wanted to note for this committee that at O'Connor Hospital, CDPH did approve our newly renovated infusion center at the hospital there. The renovation increases our chemotherapy capacity from 8 to 10 chairs. And obviously will provide private rooms, enhancing patient experience, but more importantly, improve access, timely access to essential cancer treatment. Mm-hmm. And then I will add that, as you well know, in January, we are going to have a special budget study session for the health system. That will be in the second board meeting in January, which will touch on our strategies relative to the financial challenges incurred by, obviously, HR 1, but obviously anticipating other challenges, some of which were mentioned today. We will obviously be presenting to the board in February our $200 million target reduction proposals. And with that being said, I'm happy to answer any questions.
Good, thank you, Paul. Let's see. First, do we have any in public like to speak on this item?
Confirming no request to speak on item 12.
Okay, close the public queue. Yes, Vice Chair, you have any questions? Okay, no, I just want to say, yeah, thank you so much for the update, and certainly want to congratulate our SAVH and, of course, Paul, and your leadership of having VMC being named as a 2026 high-performing hospital for maternity care by the U.S. News and World Report, which is the highest distinction as part of the annual study, and this is actually the 5th consecutive year that we have received this, so that's really tremendous. Yes, I see your light's still on. Do you have anything else to add? No? Okay, all right. So On that note, so I just want to say thank you for that. The team for working on the maternity care, improving the health outcomes. You know, obviously we have our C-section rates, our severe unexpected newborn complication rates, and exclusive breast milk feeding rates, and adoption of our birthing-friendly practices as being identified, and great news on that. I do want to bring up some comments I've been receiving. Is there was been some concerns about the number of birth being delivered over at Regional Medical Center, and there was some allegations saying that some of them have been asked to go to VMC instead of having the birth being delivered at Regional Medical Center. I know we just opened the labor and delivery, so that doesn't seem to make sense to me, but I just want to tell you this is some of the things we're hearing from some of the concerns from the community. I just want to make sure if you have heard of that, Paul, and
Thank you, Supervisor. I just want to reassure you and the community that the decisions around the clinical care and support of our patients in this area is our top priority. All the decisions are made by our clinicians in the best interest of patient care. Obviously, there is a very strong interest to build up the volume at Regional Medical Center, and at this point in time, we are on par with what the O'Connor Hospital deliveries were. The neonatal intensive care unit, you are correct, and as been reported, the numbers have been very low. That's actually not a bad thing, but at the same time, we are just starting out, and I think as the staff and the clinicians get accustomed to having a new location in that part of the county, we'll start to see the numbers start to improve. But again, our focus is on patient care, and we will do whatever is in the right interest of our patients, and also, frankly, in support of our staff. So we do have work to do, and I assure you we will report back on any improvement or changes.
Okay, great. Yeah, thank you very much. Yep. All right. On that note, that's all I have. I have a motion to receive report.
Yes, so moved.
I have a motion, and I'll go and second that as well. Let's go take a vote.
Vice Chairperson Abekoka?
Aye.
Chairperson Lee?
I as well. All right, and I believe 12, yeah, I believe.
Yeah, Supervisor, I was just curious, did you want to hear other elements?
Oh, I'm so sorry.
Item 12?
Never mind. Yes, I'm ahead of myself here. Sorry, I jumped the gun. Yes, go ahead. Yes, absolutely. Please.
Thank you.
If I may, I'll jump in on behalf of the Public Health Department. Two very brief updates I do want to share. The first is just to make you aware, an opportunity for any questions around the ACIP's action now, I think it's 2 weeks ago, related to hepatitis B vaccination. The most important thing to know is that first, while the federal ACIP did change the recommendation for universal birth doses of hepatitis B vaccine, the state of California and the county of Santa Clara continue to find that the best evidence recommends universal offering of hepatitis B vaccine. And that's especially important here in Santa Clara County, where we have a higher population impacted by hepatitis B. We know that Asian and Asian Americans are disproportionately hit by Hep B.
Yep.
That many people do not know they have Hep B, whether those be birthing parents or others in the household around a young infant. And that's why we think it continues to be absolutely the right thing for every delivery to be offered at birth vaccination, initial first vaccination against hepatitis B. We're just making sure that all healthcare providers in the county continue to be aware that our recommendation has not changed, as well as information for the general public. And then the second item is just a reminder that we are seeing high rates in our wastewater of both influenza and RSV. So we are smack in the middle of respiratory virus season, of flu season. It's here. And so I want to make sure folks remember it's not too late to get a flu shot, to protect yourself and your family over the holidays so that you can have that holiday gathering and still keep your vulnerable younger and older family members healthy. So not too late for a flu shot. Also, our older adults and infants are eligible for protection against RSV as well. And then just as you're demonstrating, Supervisor, masking, especially in crowded places. I know I'll be headed to the airport next weekend, and I will be wearing a well-fitted mask to add that extra layer of protection this season. Thank you.
Yes, protect you, protect me, right? Exactly. Thank you very much for the great report. Hepatitis B is absolutely a preventable disease. That's the key, is about the preventability and the fact that with the high occurrence of hepatitis B, especially in the Asian communities, which has been proven by the numbers we're seeing right now, which of course could result in very serious liver failure and diseases. So that's why Hep B is something that's important. I'm very fortunate, knock on wood, that being in the Navy, they give you lots of shots, and I've got my full series of Hep A and Hep B and all that, but certainly something that I think our infants need to continue to have, it's despite the conflicting guidance from the federal government. Right. So thank you for the good work, and can keep it up. All right. Any further comments?
Yeah, yes,
Please, go
thank
ahead.
you if you don't
Yes.
mind. I had a different question, and I know in the interest of time, maybe this could come back, but during the board's discussion about the Latino health assessment last week, there was mention of expanding the community health worker program in the Latino community, and I know we discussed the AAPI communities program, and I believe the funding's coming to an end. I'm wondering if there's an update, if the group was able to secure other funding, but just in general with the CHW program, what is the intent? I don't want to end one just to start, or to start another. My hope is that we can continue the program as a whole, and just your thoughts, if now or offline is fine too. But
I'll be happy to come back with that information. Thanks.
great, thank you.
All right. Okay. Yes. Dr. Terrell? Yes.
Great. You have our written report. Nothing else to add
Okay,
beyond that.
thank you.
Thank you.
All right.
I'm sorry, may I just
Sure,
quick
go ahead,
question?
please.
I appreciate the work being done with the PERT program. And again, too, if you could just provide a little bit more detail about the process and the redeployment of the PERT clinicians to Palo Alto and Santa Clara, that'd be great.
Sure. So there was one staff incumbent serving one of the jurisdictions, and there's a labor process related to filling the Palo Alto position, and then the other staff will be part of the labor process to be reassigned to available positions within the department. And as we mentioned in the report, we are continuing to work with jurisdictions that formerly had PERT to be able to ensure that, the transition is going smoothly, as well as working with ones that will have a new clinician and or retain their existing clinician.
Okay, great. Thank you.
Thank you,
Appreciate it.
Supervisor.
Thank you.
Hi, Ms. Fan? Yes. Oops, your mic is off. Try again. There we go.
I've done this so many times already, and I'm still not familiar with the buttons up here.
No worries.
I don't have anything else to report beside the written report, but happy to take any questions that you have.
Okay, I don't think we have any. Okay, good, thank you. Anybody else? All right, if not, we'll just have a motion with a second. Let's go take a vote.
I think the previous vote stands.
Yes, okay.
Yeah, we're all set.
All right, okay, good, thank you. Too easy. All right, if that's the case, I believe we are now at the end of our agenda. Am I correct?
That's what I have.
All right, good. So we'll go ahead and adjourn this meeting. And pending future approval, the next meeting is currently proposed to be scheduled for Thursday, January 22nd, 9:30, right
Note
here.
from the clerk, January.
Sorry.
There's no meeting in January, so it will be
I'm sorry. So it'll be
February.
February. Okay, all right. Thank you so
February
much.
18th.
February 18th is the next meeting. All right, thank you so much.
Thank you.
Thank you. Yes, happy holidays, everybody. Thank you.